Assalamu alaikum wa rahmatullahi wa barakatuhu. Hello viewer, this is your program once again, Health Check, a program where we bring different medical experts in different fields of health fields to help us with what is disturbing us in as far as living a healthy life is concerned. And today we're going to discuss about malnutrition, not forgetting mentioning your host today, who is Nambale Bashir. And with me to take us through the topic of discussion today is Dr. Asimwe. Bravo. You're most welcome.
It's a pleasure being here once again.
And online we have Dr. we have Dr. Ivan Muchunguzi, who will be following us all the way from the beginning till when we'll be asking for his contribution regarding the topic of discussion today. Doctor, the topic of discussion today is malnutrition. How can you explain malnutrition for our viewer to understand?
Well, when we talk about malnutrition, it is a broad term.
Okay.
Here we are looking at someone having a diet, or like you're taking a food, or you can say a diet. Either this diet is having what we say enough, or it is lacking.
So when either enough or less.
Yes. So when it is lacking, some nutrients are lacking, we get one part of malnutrition. That is what we call undernutrition. And when it is too much, now it becomes over malnutrition. So it's eating a food, whether it is lacking or having too much. So at the end of the day, you end up with what we call malnutrition. Okay. That is in a simple term.
Okay. What could be the symptoms of malnutrition, either the over malnutrition or the other one that you mentioned where one has less nutrition?
When it comes to the signs and symptoms, what do one present with for you to tell that they are having malnutrition? One, we have what we call SAM. That is when you're having maybe severe acute malnutrition, we are having some signs that everyone can easily see. Is what we call muscle wasting. Someone is losing weight.
Okay.
Or if you look at the skin, it is dry, rugged. Then another thing, we also have what you call edema. These people like swelling all over, because mostly when it is severe, at times people get in those issues. When we come back, maybe going by one organ, we can talk about the eyes. What will happen to them? We talk about yellowing of the conjunctiva. Okay. Or at times there is what we call ulcerative colitis. You get wounds around the eye, or at times we call what we brittle spots. They are like foamy in form. Someone is having them at the eyes. You can easily see. What happens to the nails? Sometimes they become spoon-shaped. Others, you can see blood within those nails. If you look at the skin, it is dry. Someone is wasted, again the skin is dry. Even when you fold it like this, it forms like wrinkles. Some people, they get, for example, you go to what we call marasmus. Someone has a big tummy, just a tummy is there protruding, but is wasted. Or they are having maybe the hair, it is there, but when you look at it, it's just shabby. In short, maybe that is the time I can easily put it down.
Okay.
But there are so many depending on which organ. There are others that come up, maybe others can get even diseases over this. So the signs and symptoms we see, if you've been taking this, what happens? Okay. Those ones that I've been talking about is when someone is having less of the nutrients. If you're having much, some people become obese. That is also over malnutrition.
I wonder someone having a slim body but having a fat tummy. It's funny indeed. So, doctor, what could be the causes of malnutrition?
To the causes, one, we look at, because this that you are looking at, it is about diet, the food.
Okay.
So all these insecurities that come around food can cause malnutrition. One, I'm going to put it in this way. We have what I can say diet practices or food practices. How do we eat our food? Are we taking balanced diet, or it is lacking? Or we are taking much more than what we need? If you're taking less, that means you're going to have deficiency of some maybe nutrients, and you end up with malnutrition. If you're taking too much of calories, you're just there, you become obese. That is over malnutrition. Again, they could be there or not, or what we can say socioeconomic event also comes in. People who are poor, they cannot access each and everything they need to eat. So in that case, you might end up losing or not taking some of the foods that contain certain nutrients that may help you. We also have what we call diseases, chronic illnesses, diabetes. Some people are having HIV.
Okay.
We are also having intestinal or diseases within the digestive system. If someone has what you call, let's say, gastric enteritis,
okay.
Someone, because we are looking at the stomach and intestines, if they have any issue, it means you eat the food well, but it cannot get digested because there is something that is stopping it. People are having severe diarrhea, or what we call dysentery. When we look at the kids, we term it as dehydration. So if someone is having that and it is not managed, they are already losing a lot. So at the end of the day, you may move to what you call. We also have other infections like parasitic infections or protozoa infections like malaria. You can have it, it is severe. Remember, when it is severe, it means you're not eating. In that system, you're losing many things.
Okay.
So there are as many as you can pull them down. But anything that rotates around food, how do I easily get food? So anything that is a sabotage, how to get it? When you're eating, even digestion of that food that you've taken, all of them can bring about what we call malnutrition.
Okay.
To those who are eating habits, people who overeat everything you're picking, what we call calories, junk food, every time you're eating, come over malnutrition now. That is what you're calling obese. You're not exercising also. It is a factor.
So you're overeating and you're not exercising.
It is also part of it.
Because which can almost all the food that you're eating into calories. Thanks a lot, Dr. Asimwe. Obesity is among the causes of malnutrition. So as long as you like eating too much, do the exercise as well to help the body consume what it really needs. This now calls me to my brother, Dr. Ivan Muchunguzi, who I would like to give us the complications that come with malnutrition. Dr. Ivan, what could be the complications of malnutrition, Dr. Ivan?
Thank you so much for this opportunity. Concerning the complications which have asked me about in case malnutrition is not treated, like we said before, malnutrition arises from taking unbalanced diet, which includes carbohydrates mainly and proteins, which are the bodybuilding foods. So in case someone has malnutrition, depending on the age, whether a child, an adult, or elderly, and no intervention is done, someone will be at risk of having a lower immune system. And once your immune system is low, you'll be at a risk of getting ill every time and then, since your body will not be able to not be having the necessary foods, the proteins, which will help to fight and boost the immune system. Then another thing is that once you have protein energy malnutrition, in this case, let's say you have kwashiorkor, you have marasmus, you don't have the necessary nutrients, especially the proteins, which will help in development. So concerning development of the brain, there will be slow memory and development of the brain. And for the case of children, they'll have what you call stunted growth. You're going to see a child of 10 years, but he's very short. That is what we call failure to thrive. Then, of course, we have other deficiencies which come on with malnutrition. For example, if you're not taking in inadequate vitamins, for example, vitamin A. Once you lack vitamin A in your body, you're going to be at a risk of suffering from blindness. Vitamin A is a very essential vitamin for the development and improving the eyesight. So once it lacks in your body, you'll be at a risk of getting night blindness. Then still, concerning the vitamins also, once you're lacking them in your body, you will also be at a risk of getting anemia. Anemia is a condition whereby you have insufficient or reduced number of red blood cells which are carrying hemoglobin and thus carrying oxygen to the different tissues of the body. And once you get anemia, you can also be at a risk of getting respiratory distress, since oxygen won't be enough to reach the lungs for oxygenation. But all this comes about when you're not taking enough vitamin B12 and folate and vitamin C, which help in improving the HB of blood. Then also, regarding that, when you talk about malnutrition, it also comes, mention you can also have, in this case where someone is taking in a lot of proteins, and he may end up getting what we call obesity. And in this case, someone will be at risk of suffering from these cardiovascular diseases such as hypertension, atherosclerosis, which are very fatal for our life. So generally, those are some of the complications of malnutrition if it is not treated. Thank you so much, moderator, for giving me this chance.
Thank you so much to Dr. Ivan for your submission regarding the complications of malnutrition. Doctor, you've had Dr. Ivan's submission. I now have to go to, I have a friend of mine that is Dr. Baker. Dr. Baker has a saying that prevention is cheap, whereas cure is expensive. Prevention is affordable, but cure sometimes has a lot of costs that move with it. So here I'm requesting you, according to the causes and the complications that Dr. Ivan has aired out, it is a bit worrying if you see a child of 10 years looking like a 4-year-old child. That is indeed not a good sign. So here I request you to tell us what should one do to prevent him or herself or their loved ones from having this malnutrition disease.
As you quoted Dr. Baker's word, we can easily prevent because it is cheap, it is affordable, everyone can easily try out some practices.
Okay.
One, when we talk about, for example, socio-economic issues, maybe people who are living under poverty line that may not access each and every thing that we are getting, all these nutrients, that we are eating all the food. We can see, because when you go back to our villages and what, those people are actually doing well. So number one is maybe what I can say as food security. In some instances, we need to know how are we protecting now this food, even the little that we are having. Because the rest we can also have substitutes that we can give.
Okay.
But at the end of the day, even the small we are having, are we using it in a good way? Then the second thing is, I always talk about this issue of health education. It is more so for medics to teach, because we always talk to our patients. Whether they are dealing with any case, we need to talk to them. Is it a chronic illness? If it is diabetes, how is someone supposed to eat? You have what you call diabetic breath. You teach them out. Then, even the people who are there, you come to us, you get the information, because you might find you have everything, but knowledge of it. How do I use it so that I don't end up maybe in such a way? Then again, on how we can easily prevent them, because most times we need a good training. I'm talking about even us, the health workers, because at the end of the day, we are many, but
yes.
not everyone talks about maybe nutrition every time you visit them. That training can easily standardize the treatment,
okay,
or can easily tell people how to easily prevent them. Because at the end of the day, if I'm not trained within it, then how am I going to discuss it to you? And then, physical exercises. Now we are talking about people who are, when we talk about over malnutrition, who are obese. You need to lose weight. Because if you don't, it has a lot of complications. Even malnutrition itself, like you heard Dr. Ivan talk about them. You're going to have anemia, and that is now another issue. So we need to see how can we easily cope up with our lives first. So there are small things that we learn. We start with taking balanced diet, drinking enough fluids. I'm talking about drinking water, not the other stuff. And then
not the opposite of
exercise
water.
plus the rest. There are as many as we can mention, so longer depending on what this person is having. Again, if someone may be sick, you already know that they're having this condition. How do we deal with them so that we prevent all this out?
Okay.
Yeah.
Okay, thanks a lot, Dr. Asimwe. And to you, Dr. Ivan, as you give me your concluding remarks, in case I suspect myself to be having malnutrition, what advice do you have for me, Dr. Ivan?
As I come to conclusion about this topic, once anyone suspects that he's malnourished, the best option should be to come to the hospital, whereby we are going to have the different medical workers and health service providers who are going to help him, assess him. Because like I've told you before, we have different classifications of malnutrition. It could be undernutrition, it could be protein energy malnutrition, it could be, which includes marasmus or kwashiorkor. All those classifications of malnutrition, they need different interventions. So the advice I could give to the people outside there who would be suspicious of being malnourished, the best option would be to come to the hospital. We do all the clinical assessments so that we can see what they need, because there are those who need to be supplemented on some foods. There are those who may do some biochemical tests and we find they need some supplements like minerals. It could be minerals like manganese, like sodium or potassium. So to all the people outside there, once you suspect that, don't take long home, because the more you take long being at home, the more you'll be going into severe states. So just work on it quickly and come to the hospital, whereby you're going to receive the best treatment concerning the deficiency you have. But in addition to that, at the end of it all, we shall always encourage them to look for ways and have knowledge about the ways of preventing malnutrition, because like we all know, prevention is better than cure. Once they follow up on the preventive measures of preventing malnutrition, they will live a sustainable life. Thank you so much. I'm Dr. Mchunguzi Ivan, working with Mulago Hospital.
Thank you so much, Dr. Mchunguzi Ivan. Mulago Hospital is the national hospital for Uganda. And doctor, he's agreeing with you. Prevention is better than cure, and good enough. You have given us some preventive measures that we have to use to get rid of this malnutrition disease. And as you give me your concluding remarks, doctor, your advice to our viewer today.
When I come to my concluding remarks, most of the things we've already talked about today. Maybe I can do a small supplement to what he said.
Okay.
Because when we look at this malnutrition, we categorize it. We have what we call different forms of it. We have acute and chronic. But then when we come back to acute, I mean it has been there for a short time, chronic it has been there for a while. So for this, then we term it to be, we have what you call SAM, that is severe acute malnutrition or what you call moderate acute malnutrition. When you come to us or you go to seek medical advice, after assessments and what, they can easily direct you on what to do next, because we have a different protocol that we follow when giving out treatment for these people.
So I don't need to go to YouTube to download some, you know, we have a tendency, we need to do all the medics at home.
Now, for example, let's say we have now for us a protocol. How are you going to measure to get to know that this person needs maybe part of the glucose? Because we do a test.
YouTube won't show you that.
On glucose levels.
Okay.
We need to see the temperature, what you call hypothermia. It has reduced. Then we also need to give a test, other test, what you call appetite test. If you fail all this, because we need to do other treatments, how do we initiate yourself on, let's say, antibiotics to treat infections when you're on YouTube? And then how do you prescribe feeding on YouTube? So it's better to interact with the medics. They understand. So look, you seek for, try to say, advice. I think medical advice, when you seek for it, is the best I can advise on. And again, look at all the practices we talked about.
Okay.
Yeah.
Do more exercises. Self-medication is not advised. Despite watching this program, we all have different blood groups. We have different lives. We have different bodies. And please take this advice that even after watching this program, you have to go to your own medical doctor to assess your body in person. So do not do the self-medication. That's why we do not prescribe any medicines. Our advice always remains, go and see the medical expert who will study or examine your body and let you know that such and such a medicine will work for your body. Unfortunately, time cannot allow us go beyond this. In case we have not satisfied your need regarding the topic of discussion today, well, we can connect still. We have an email where you can reach us onto, and that is africa@mta.tv. And in case you have come in the evening or in the closing part of this program, you can still find it on YouTube. That is MTA for Africa. There you're going to watch this program and you're not going to miss it. You might be watching this program at your neighbor's home. You might be watching the program where you're not comfortable. The world today is a global village. You have MTA on your smartphone, you have MTA on your laptops, you have MTA on your smart TVs. Just visit your Play Store and download MTA International, where you're going to have almost 8 channels for you, so you won't miss anything. Anytime you might be in need of watching programs like this while traveling, so you won't miss anything. Just download the MTA application. It is both on Play Store and on my brothers that use iPhones. You will find it there. That is MTA International. 8 channels for you to entertain both your soul and your lives. Today's program is Health Check. Do not touch your dial, do not touch your remote. More faith-inspiring program still coming in, so please stay tuned in MTA. I remain your host, Nambali Bashir, and until we meet in the next episodes, inshallah, assalamu alaikum wa rahmatullahi wa barakatuh.